Did you know you can lower your blood pressures with supplements? That's right. I'm going to give you 5 supplements that you can utilize in your regimen that will lower your blood pressures. I'm Christina de Nwoha. I am an internal medicine physician, board certified. I work in a hospital. I see a lot of high blood pressures. I see a lot of hypertension. I have struggled with high blood pressures myself and been able to turn it around. And I've also helped my friends, family members, and clients with their battle with high blood pressure as well. I want to let you know that supplements do work. And I'm going to tell you why. A lot of times when you go to the clinic, you go into the doctor's office, they check that blood pressure and it appears to be a number, just a high number. And a lot of people assume that blood pressure is high in everyone for one reason, and that is because they need blood pressure medications. That's simply not true. Your high blood pressure is not a result of the lack of medication. There's something going on under the hood. A lot of times we have to get into that and figure out what the root cause is. Now, I'll tell you a few root causes. It could be a nutritional deficiency. A lot of times we're not eating the right foods, we're not getting the right foods. And sometimes we are using up certain nutrients and electrolytes in our body faster than we can take them in and replace. And that can result in low or high blood pressure, but we're talking about high blood pressure now. Poor eating habits, processed foods that do not have any nutritional value. Also, we want to consider that the soil that we're using now is not the same soil as before. And certain ingredients can actually block the absorption of nutrients, electrolytes, and minerals, leading to high blood pressure. And also, just your environment can subject you to high blood pressures. Lack of sleep, hormonal imbalances, stress. You know, we're in this society, this time period where it's go, 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 I'll sleep when I'm dead, grind, 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 and that can have an impact on your blood pressures as well. So you can imagine when that number is elevated, it's not as simple as just start this medication. Now, of course, there are times where starting that medication is absolutely necessary. Absolutely necessary. And we're going to touch on that in a different video. That's why I need you to stay tuned and subscribe and be on board for more. But in certain circumstances, supplements can and will help certain people in certain circumstances. I'm going to make you knowledgeable. I'm going to make you privy to different supplements, how they can be used, when they shouldn't be used, what the side effects are, and what you should be careful about. I want you to get all the knowledge you need right here in this video. Let's go. Now, before I jump into the supplements, I'm going to take this one key moment to stress to you the importance of working with your physician when implementing any new supplements into your diet. I'm a physician myself. I speak to physicians. I'm surrounded by physicians, friends, colleagues, and I will stress this to you. It is very important. A lot of these supplements can interact not only with other supplements, but other medications. Some of these supplements have side effects, have bad outcomes that you might need to monitor and look out for. And you may not know what's going on unless you bring it up to your primary care physician. Now, some of these supplements may drop your blood pressure so low that it becomes problematic. Your primary care physician may need to adjust your medical regimen to make room for some of these supplements, and that's a great thing. Now, some of these supplements, if they interact with key important medications like a blood thinner, your primary care provider may let you know to try something else or to stay clear of certain supplements. So I want to reiterate the importance of bringing your primary care provider into the loop when making decisions like this. It's not just a one-sided thing where you go to the grocery store, buy up a bunch of supplements and start them tomorrow. I need you to involve them in the loop and feel comfortable doing so. Feel comfortable sharing what you have learned with them so that you guys can have that two-way conversation and make decisions that are best for your health. Now, without further ado, let's jump into the first supplement. Now, the first supplement, I'm going to start off with magnesium. How can I start a list about blood pressure supplements without going straight to the mag? Okay, mag is a mineral that your body uses in so many ways. So many ways, so many different functions. But we are talking about that balance between potassium and calcium at the cellular level. The fact that magnesium at the vascular level will take a blood vessel that's tight like this and relax it and make it open like that so that blood can go through. That results in lower blood pressures. That relaxation of the muscle and the vasculature is very important when it comes to magnesium. A lot of people are deficient in magnesium. I'll say that again. A lot of people are deficient in magnesium. Either it's because they're not eating the right diet, they're not eating magnesium-rich foods, or they think they're eating the right diet, but the magnesium is not in the foods like it used to be. So you can imagine that supplementation is going to be a lot more commonplace now. People will say, why should I take magnesium? I can get it through my food. Are you? Are you being intentional about your food? Are you being intentional about eating foods that have high magnesium content? I like to list and show images and guides for high magnesium foods, high potassium foods. And if you want to find that, you can find me and follow me on Instagram or on some of my other social media accounts, and you will see all that information there. But for these intents and purposes, I'm going to assume that you're not getting the magnesium that you need in your diet. So you may need to supplement. Now, how do you supplement? There are different ways. If you go to the grocery store or you go to your supplement store, you're going to see 100 different magnesium bottles on the shelf with all kinds of different names. And I'm going to outline every type of magnesium and its benefit, but I need you to know that it's going to be important to find the right fit for you. For example, magnesium glycinate or biglycinate is going to be great for sleep. It really helps with anxiety, that muscle relaxation, and it will knock you out like a rock at night. So a lot of patients will use that to defeat their sleep problems and handle their blood pressures as well. Another magnesium that's great is magnesium citrate. It's readily absorbed, and it also helps with the GI. If you're a little constipated, you're not very regular, you want to have a bowel movement, it's going to handle that too. Now, one magnesium I do not recommend is magnesium oxide. It's not absorbable. You're going to see it everywhere. It's cheap. But if you really want to get onto deficiency, then I would avoid magnesium oxide. As far as any other magnesium, you could do a little research, but most of them have a medium to high absorbability and will get the job done. Even if you're applying a lotion or a spray, it usually will be absorbed pretty well. So who should be careful with magnesium? I would say if you have any kind of chronic kidney disease or heart disease, you may need to run this past your doctor, your kidney doctor, your heart doctor, your primary care doctor. These doctors need to know if you're taking any high doses of these supplements because they could be giving you other supplements, other electrolytes, other medications that could derange some of these levels. So definitely keep them in the loop. Doctors do use magnesium all the time. They use it to treat high blood pressure, especially in OB. You will see IV magnesium being given for severely elevated blood pressures. And a lot of heart doctors will use magnesium because it's great for the heart, great for arrhythmias, and great to stabilize that heart membrane and good for the vasculature as well. So your doctors know about magnesium. Talk to them about it. The next supplement I want to talk to you guys about is one that I don't see mentioned. So yes, let's do it. This is my time to talk about dandelion root tincture. Now, if you know me and you followed me for a while, y'all know that I love this stuff. This stuff works. What is dandelion root? Dandelion root has been used in traditional medicine for years, okay? For ages they have been using it, but primarily its use has been in liver function, liver aids, liver detox, okay? When it comes down to detoxifying the body and people want to really focus on that in the traditional medicine realm, that's when they pull out that dandelion root. You know, when you look at the dandelion, all of those components can be used, dried, made into teas, capsules, supplements, and It's just great. But one place that I'm going to narrow in on is its diuretic effect. You see, when you take in that dandelion root, you will urinate. And for some people, that helps with the blood pressure. Some people are struggling with this water imbalance. You have a vessel, but you just have so much water in it that's just pushing and causing that increased pressure. And that's why many people are prescribed diuretics. Okay, you got a diuretic like Lasix or hydrochlorothiazide, because the thought process is if I have you urinate out that extra fluid, then your blood pressures will return to normal. What I love about dandelion root is it's a little gentler than your Lasix or your hydrochlorothiazide. It's gentler on the body. Now, dandelion root is so strong, it's so powerful, and it will drive down your blood pressures. But I want to make this warning here, and that it's not something that I would use long term. It's not something that I would take every day for the next 5 years to control my blood pressure. I like to consider dandelion root as a sort of damage control. You went out, you had, something salty, or you ate out with your friends, and now you're battling a little bit of high blood pressures here, and you want to bring them down, quickly. Or, you know that you're kind of having some hormonal changes, holding on to a little extra fluid, and you want to try some dandelion root tea. A-okay. But it's not something where you're going to be taking a dandelion root tablet every day. I would not recommend it. It is strong, and because it is a diuretic, it can alter your electrolyte level. So you have to make sure you're staying hydrated. You have to make sure that you're getting your electrolytes and your minerals and staying balanced. If you're taking diuretics already, there's some people who are already taking Lasix, already taking hydrochlorothiazide, already taking Bumex, or whatever medication that you're on that's making you urinate more. This is not the time to be adding dandelion root to the mix. That can get dangerous because your body is already working hard to release whatever fluid that the medication is telling it to release. And now you're adding another diuretic on top of that. That can cause a lot of electrolyte imbalances, dehydration, falls. We don't want that. So if you're not sure what kind of medications you are on, this is why it's going to be important to talk to your primary care provider and say, hey, this is something I'm thinking about taking. It may cause a little diuresis. Am I cleared to take it? They may tell you, no, you're taking a water pill already, and we might need to try something else. And that's totally fine, So this is something to keep in mind. Another group of people that need to be careful with the dandelion root are patients who are on blood thinners, okay? Dandelion root can interact with warfarin, Coumadin. If you're on a blood thinning medication because you've had atrial fibrillation or you've had a stroke, or for whatever reason your doctor needs to keep your blood thin, this is not the supplement for you. Please proceed with caution and don't do it. Also, if you have a ragweed allergy, dandelion is a ragweed, so you're going to have problems with this. This is not the supplement for you. So I encourage you to, again, do your research and find the right fit. Dandelion, while it's a potent diuretic and it's great for liver support, may not be the best one for everybody. So keep that in mind. Now, the next supplement I want to talk about is CoQ10. And if you've been moving around on YouTube, it's something that I think you've already heard about, but I'm going to explain it here and what it can do for you. So CoQ10 is a coenzyme that's made in your body, and it's usually talked about when it comes to the mitochondria. That's your powerhouse where energy is made inside the cell. It works as an electron transport carrier for the whole ATP model, but that's getting a little intense. Let me just break it down to say that it protects your vessels from damage, in other words. And your body makes it. But there are 3 ways that you can become deficient and may need it, okay? When it's protecting your vessels from damage, you have to understand that the damage to the vessel can cause it to constrict. which can cause high blood pressure. All that inflammation and damage going in there, CoQ10 is going to help with that. Now, when you're deficient in CoQ10, you might notice your blood pressures are going up. What makes you deficient? One, age. As you age, your CoQ10 levels will decrease. All of us are aging. All of us are aging. So how many of you guys are saying that, oh, okay, when I was younger, I never had a problem with high blood pressure. As I get older now, I do. Could it be a CoQ10 thing? That's some food for thought here. Secondly, medication. There are certain medications that interfere with your ability to make CoQ10. Like statins, your atorvastatin, your rosuvastatin. They can cause a depletion in the CoQ10. So you have to be careful. I know a lot of heart doctors that are prescribing, or not prescribing, but they're asking their patients to also take CoQ10 with statins to kind of mediate this effect. So if you're taking a statin and you're feeling fatigued and you feel like your blood pressures aren't as controlled as they used to be, this could be something that you look into. Talk to your heart doctor about it. They know about it. Trust me. I've seen a lot of them speaking about it, and I've seen a lot of them have their patients on it as well. So it's not foreign territory for them. The next reason you could be deficient is because your food, your diet, you're not eating well. CoQ10 is found in our diet, and our body gives the building blocks for it. So if you're not eating meat, fish, certain vegetables, then you can be deficient in CoQ10. So I just got done telling you all the great things associated with CoQ10, but what are the side effects? There are side effects associated with CoQ10. Some people will complain of a headache. If you start taking CoQ10 and you just have this gnawing headache, that might be your problem right there. You may need to consider backing off, reducing the dose, or taking a break. Another issue that people may have is insomnia. Because it's almost like an energy boost, if you take it too late in the day, you may have difficulty falling asleep just because of the CoQ10 dose. So you may need to consider taking it earlier in the morning, first thing upon waking, if you find that your sleep is affected. It may also cause some GI intolerance, diarrhea, and stuff like that, which may be manageable for you. It just depends. But these are things to look out for so that you're not thinking, oh my gosh, what is going on? It may just be this supplement. The next supplement I'm going to talk about is beetroot. Okay, beetroot. Now, this beetroot can be formulated in a bunch of different ways, from a powder to a capsule, or you can juice it yourself just by literally going and buying beetroot and putting it through a juicer. It's important to talk about because this has a great effect on the blood pressure. Now, beets have a lot of what you call nitrates that when you ingest them, your body turns into NO, which is nitric oxide. Nitric oxide goes to that vessel that is tight like this and acts on the vasculature, opening it up and causing relaxation of those vessels. Now, of course, when they're relaxed and open, blood goes through it easily and your blood pressure goes down. Great. I don't have to tell you much about beetroot because I'm pretty sure you can find it pretty much everywhere. It is all the rave right now. Athletes are loving it. It's great for cognitive decline. I mean, it has many claims to fame right now, but I need you to know that one claim to fame that I'm harping on right now is blood pressure control. It can help with your blood pressure. Now, here are some things that I need you to know about the beetroot powder before you go off too fast and end up in trouble. Beetroot powder is high in carbs, about 25 grams in 8 ounces of a juice. So if you have diabetes or you're struggling with your blood sugars or you're watching your carbs, you're watching your weight, this is something to weigh in. Okay, it does not come without this baggage. This is a beet. It's a high carb vegetable. If you're watching your blood sugars and you're seeing these spikes, it could be the beetroot juice. Absolutely. I've had clients that they're working on their blood sugars, they're working on their blood pressures, and they notice that, every time they're trying, they can't narrow down where these spikes are coming from. It was the beetroot. And that's why it's important to keep your primary care team in the loop with everything, because these are some things that can interfere with other conditions. Now, the next thing I need you to know about the beetroot is oxalates. Oxalates can cause kidney stones, and beets are high in oxalates. So if you're already suffering from kidney stones, or your primary care physician or your urologist has told you to be careful with oxalates and diets with high oxalate content, then I don't suggest the beets for you. You might have to find another supplement. I'm still trying to figure this out, and nitrates have really gotten a bad rap when it comes to cancer. And I think I'm going to dedicate a whole video talking about this later, but nitrates and cancer of the gut. Now, a lot of times we think about the nitrites and the nitrates like in red wine and your smoked foods and cured foods. We're thinking about cured and smoked meats. But no one knows where the nitrates that are in the beetroot, how that goes. And because it's unclear, I just want to put that in the back of your mind to always consider. I don't want 10 years from now someone to come up with some kind of scientific evidence that beets are part of that. So I would just say use it, sporadically. Don't make it be something that you're, consistent. Just kind of play all of these things through your mind when you're making that decision to intake the beetroot supplement. Lastly, I've got to end with vitamin D. I love vitamin D. I'm on my vitamin D soapbox all the time. And remember when I said you can be deficient in certain nutrients and this cause your high blood pressure? Well, I was talking about vitamin D. They have shown that people who are deficient in vitamin D are more likely to have high blood pressures. So that's something that you may need to consider correcting. I need you guys to know that vitamin D is involved in the renin-angiotensin system and also with the calcium homeostasis. And we've already talked about how calcium balance and all of that is important for blood pressure when we talked about magnesium. But that whole renin-angiotensin system is important when it comes to blood pressure control. Because if you're taking lisinopril, which is attacking that renin-angiotensin system, it is working on that to bring your blood pressures down. And we just said that vitamin D deficiency is linked to that. Why wouldn't you want to replete your levels? Vitamin D deficiency is also linked to so many things, from insulin resistance to inflammation. So get these under control and your blood pressure can see improvement as well. Now, I haven't found any studies where they've shown that taking this much vitamin D will reduce your blood pressure by this much. But with all of that other evidence, why wouldn't you want to have all systems go there? I cannot imagine that having corrected vitamin D levels could have beneficial outcome for you in the whole grand scheme of things. If we know that having low vitamin D levels hurt you, then I can assume that having corrected and good vitamin D levels would have a great impact on you as well. This is a new channel. I am moving into YouTube. I'm not going nowhere. I'm providing all the knowledge you need. Now, I'm going to be moving pretty fast, and I'm going to be uploading these videos hopefully weekly or every 2 weeks. I need you to subscribe, like, share, and return frequently so that you can catch the next video. Now, if I'm moving too slow and you want to get all this information at your fingertips, I've already written a book. The link is down below. And if you want to talk to me, the link is down below as to how to get in contact as well.